we need people to be aware of it, to be able to talk about in a free and fair manner, in a frank manner, and to overcome the stigma which is connected to any issue connected to mental health. There is a stigma, there is a sort of discrimination which creeps in, and people also can be also ridiculed if they are having any mental health problems they face from their co-workers or co-students, and sometimes people laugh about them or joke about them, and which can aggravate the situation more. So it's not just that people who have mental health issues need to be more aware, it's also society as a whole needs to be more aware of this and how we can help. So that's what advocacy is all about, that we bring about awareness, we tell them what the issues are all about and how you can take treatments, how solutions are available, and also at the same time bring about some training, counseling and all those things, and also let other people know how to handle it, how you face up to it and how you handle situations like that. So these are the things that I think are connected to advocacy, that we bring about that people understand what it means. So there are so many issues that we face. I think as students, many of you, I think most of you are students over here. So as students also there is a lot of stress which you do not probably realize that it can be a mental health issue also. There could be so much of anxiety, so much of worry, and which leads to other things that happen in your life. It can lead to addiction to alcohol, addiction to drugs, or being obsessive about things. And these are the things which have the impact of mental health leads to all these things. And not able to sleep properly is also a mental health issue. Having disturbed sleep on a continuous in a continuous manner is also a mental health issue. So how do we solve that? So there are so many things that are connected to mental health, which we may not realize is part of mental health, because we don't want to talk about ourselves as being people who might need support or might need help, because we feel that somehow we will manage it on our own. And initially certain things may not be that serious, but if it's left untreated or unattended, then it can lead to graver consequences or more serious issues. So anyone suffering this, it has an impact on their lives. Mental health has an impact on your physical health. And if both your mental health and physical health deteriorates even say by 5% or 10%, forget about being severely affected. That is obvious, then it's going to affect you a lot. Even if a small impact is there, that has an impact on your productivity, how you can perform, how you can, whether at work or whether at studies. It has an impact on your productivity. Ultimately, what it means is it somewhere impairs you from being able to achieve to your fullest and to maximize your potential. So that is what ultimately as a society, what do we want? As a government, what do I want? I want that every person in this country will be able to live up to or realize his potential to the maximum. Every person becomes productive. Every person becomes an asset. So if each individual in this country can live up to his dreams and be able to do whatever he wants to do, that is capable of, and that is something is what we as a state need to empower our people with. So that broadly covers education, good health, all those things. So in that, mental health is becoming a bigger component, not just physical disabilities or illnesses which are of the regular type. So when we, as a health minister, I want my citizens, my people to be fully empowered. And for that, I think what the attention that we need to give to mental health is definitely a very, very serious area of concern for us. And we are seeing, like for example, we've got a facility now where people can call across the state, called the Tele-Manas, that anybody can call where they can get specialized service. So we've got two centers. One is in Nimans in Bangalore, and one we have another one in Dharwad called Dimhans. So because we have a lack of professionals who can go down to the rural areas or the taluka or to the talukas, and professional advice may be difficult for them to access. So we need to create an access. So we have this Tele-Manas facility where people can call up, tell what their problems are, what are the issues they are facing, and then they'll be guided by them to what can be done, what needs to be done, and locally where they can go and talk to, and whom can they talk to, and who are the people whom they can approach. So that is, the number of calls that we're getting is running into lakhs. I think in just 2 years, it's more than 5 lakh calls that we've received across the state. People are calling. So people from rural areas, from villages are calling, and poor people. So sometimes we think that stress and anxiety is a rich man's problem. It's not. It's everybody's problem. Everyone is going through that. But they may be having greater challenges on their daily, existences, which they need to take care of. So they may overlook it. But many of them also have the same issues. So the number of this mental health program that we have, I think Karnataka, I am proud to say, is one of the leading states in handling mental health. And we've got now district mental health programs, and we've got down to the talukas also. We are number one. We are number one in the state. Mr. Kumar, he is very well, because he is a pioneer in this. And I think he will explain more when he speaks. So whatever he did led to the act also being brought about, the National Mental Health Act, 1987 Act. So whatever his work on mental health led to this act being passed in Parliament, and that becoming standard for all of us in the states. So we have given great attention, and so far in our public health institutions, we've got another wonderful program called the Super Tuesday program. I think you are aware of it. So every Tuesday, people who understand mental health, professional, doctors, they go to our primary health centers in the rural areas. And every Tuesday they go there, and people who've got any issues concerning, if they have psychosis or OCD, or if it's addiction or stress and anxiety and sleep disturbances. So anybody can. So every Tuesday it's called the Super Tuesday Clinic. So that is a wonderful program, I think, which is giving out good results for us, and we are trying to make it more impactful. And even suicide prevention, that's another thing which is where people are led due to all the various issues in their life, ultimately take the extreme step of committing suicide, and especially young people also are taking these extreme steps. And not only suicide, but suicide attempts. The number of attempts to suicide also is another major cause of concern. So all these things, we are trying to work at, and our district mental health program, I think, is a model now. And along with that, we have launched another program called the Brain Health Initiative, where we have tied up with Nimans. And in every district hospital, we've got a facility now with a speech therapist and a physiotherapist and a neuro and a person from a doctor who's done neurology. So they are able to give in every district now professional treatment to our patients. So dementia and even schizophrenia and all these things. So we have taken a multi-pronged approach, and these are one is on the treatment part, one is on the curative part, but I think what is more important, I think, is what we're doing today, in terms of advocacy, so that we involve more people, involve society, involve youngsters, older people, senior people, And it's not that it's only for young people, of course. Everyone whoever we can attract and bring them on board onto the advocacy, that is important, including government, including our ministers, including our MLAs. Just now, Justice was telling me that he has proposed a mental health program for all the ministers of Karnataka. So, I think we definitely look into proposing. So there's no stigma to it. See, the minute we say mental health program for ministers, we all laugh. Because we say, okay, something that, maybe the ministers need mental treatment. Or MLAs need, it's not that. I think probably in this hall, there could be at least maybe 15-20% who need mental health assistance. But we don't want to acknowledge it, we don't want to talk about it, we don't want to discuss it. But it may be, in this very hall, there are many people who need it, require it. So I think the subject is serious and we can probably smile about it or laugh about it, but I think the impact is of having these mental health issues is something that we cannot actually quantify so easily. It can really destroy a family, it can ruin peace in houses, it can bring about so many problems that if left unresolved between siblings, between parents, between father and children. There are so many things, and people even having temper issues is an issue which is ultimately connected to mental health. All these things need to be addressed and need to be recognized. Suppose if I see my mother or my father getting angry all the time, maybe some of it could be justified, but some of it is not justified. And I should be able to point out to her that, Mom, I think you need to see somebody and discuss this with somebody, because this is not the way to handle the situation. So that leads to breakdown in families, unnecessary stress, and so many issues can be treated. So many things have got even medications. If taken, you can lead much better lives, much more normal lives, much more peaceful lives, and not just for yourself, but people around you. So I think these are the broad points I wanted to make today, and I think covered the subject, I feel, to whatever I could understand about mental health. And we are very serious about this in our state, and Karnataka is, like Justice said, a pioneering state in this. We have taken up major programs, and even in this following year, we are expanding. We just recently expanded our mental brain health initiative across the state, and we want to percolate down to the village level, so that they also can access all these good programs. So I want to congratulate Priyanka and her team for having done this. Inspiron that has come out with this program, and ultimately you people should become advocates. What is our intention is that all of you become advocates. You become